take you live to Hobart. This is Rebecca White. She is a Labor candidate and she wanted to be the Premier. Didn't work out for her in the state of Tasmania, but she's trying to get into federal parliament. So we'll see. We'll listen to her and then we'll hear from Anthony Albanese.
One of our very busy emergency departments if these services were not available. The people I've spoken to across my electorate have told me that they love our Medicare urgent care clinics. They're excited that Labor's going to deliver 3 more here in Tasmania, including 1 more in Lyons in Sorell. And my response to them has been, if we love them, we have to vote for them. Because the only way to keep Medicare urgent care clinics and to keep them free for people to use with just their Medicare card is if an Albanese Labor government is re-elected. And that is the truth of it. My opponent just a few weeks ago couldn't say clearly whether or not people presenting to a Medicare urgent care clinic would be able to see them doctor for free. The Liberal candidate in this electorate is not able to clearly tell people whether or not these services will remain free under a Dutton government, and that should be enough to convince anybody who loves a Medicare urgent care clinic to vote Labor, because that is a guaranteed way to make sure that it's just your Medicare card that you need when you present here to see a doctor. I'll hand over to the PM.
Well, thanks so much, Rebecca, our fantastic candidate here in Lyons, who will make an enormous contribution to our team in the National Parliament. And it's great to be at this urgent care clinic. This urgent care clinic here in Bridgewater, one of 5 in Tasmania. We promised 50, we've delivered 87, and we're going to deliver another 50. And they have been an enormous success. Across the country, some 1.3 million Australians have got the care they need, when they need it, with just this little bit of green and gold plastic here, their Medicare card. That's all they have needed to come in, get the care they need. In addition to that, of course, taking pressure off emergency departments of local hospitals. It's just one of the measures that we've put in place, together with $1.7 billion of additional hospital funding, together with the tripling of the bulk billing incentive, which we did first for concession card holders, and we know that lifted the bulk billing rates up to 90%. What we are doing, committing to and put in the budget is another $8.5 billion to allow for the tripling of the bulk billing incentive, which we expect will see 90% of people being able to see a bulk bill doctor for free, making an enormous difference. This is one of the big contrasts at this election campaign. Labor committed to building Australia's future, strengthening Medicare, making sure that people are looked after with cost of living measures, including being able to see a doctor for free, the reduction in the costs of PBS medicines to just $25, the same price that they were in 2004, $7.70 freezing the costs for concession card holders, the 60-day prescriptions, which, remember, when we introduced that into the Parliament, the Coalition said the world would end if that happened. Chemists would close, there'd be a devastating impact. Well, none of that was true. What is true is that more people will get to see a doctor for free. What is true is it will take pressure off emergency departments. What is true is that people will pay less for their medicines. Now, to be fair to the Liberal candidate for Lyons, she probably heard Susan Ley stand up in the Parliament and say that if something is free, then people don't value it. That's the Liberal Party philosophy. Well, Medicare is free. That's the whole idea. The whole idea is that whether Kerry Packer has a heart attack, ended up in Royal Prince Alfred Hospital, the same place I ended up when I had a major car accident in January of 2021, and the same place that my mum ended up when she had an aneurysm. Whether you're an invalid pensioner or a billionaire, you get the health care you need when you need it because you're Australian. That's Australian values. That's why we don't want the Americanisation of our healthcare system. But you have Susan Ley say the quiet bit out loud. There's been a bit of that lately. You have the leader of the opposition who quite clearly ripped $50 billion out of hospitals, tried to introduce a GP tax. So it's not surprising that the local candidate here said this very clearly. When asked, would this continue to have bulk billing, they said, live on air, something that we will need to be working out. Well, I think we know what that means. Because if you've got a huge figure, $600 billion you've got to pay for nuclear reactors, the cuts have to come from somewhere. And when Peter Dutton cuts, you will pay. Consumers will pay. That is one of the big divides and the choice that's before Australians at this election. Now, I'm going to call upon Dr Mark Baldock, who is a doctor here at the Centre. Then we'll hear from Katie Gallagher. Then we're happy to take questions.
Thank you. Thank you, Prime Minister. A very warm welcome to everyone here today. It's not often we have so many people in the emergency treatment room. It's, all I can do is further add to what Rebecca and the Prime Minister has said on how important urgent care clinics are to Australia-wide, particularly for a community like the one we're in today, who has its own socio-economic challenges. And I'm proud to be involved, and all the people involved with the clinic are proud to be here to say that we were able to keep this clinic open and we were able to extend the services in this clinic and make a huge difference to primary health care because of the funding from the Australian Labor Party and the urgent care model that they've presented and the support that's been given to the future of Medicare. So I can only congratulate and thank that policy decision and that philosophy of making healthcare accessible to all. So I'm really happy to announce that today that Jordan River Health will be becoming a 100% bulk billing clinic under the new My Medicare model, and we'll be going forward to providing healthcare and free access to healthcare in this community. So I'd just like to say, on behalf of the team here and my group, the GP Collective, is thank you to the Australian Labor Party for putting healthcare first. Thank you.
Thanks very much, Mark, and what a great announcement. And again, it shows the investments that the Albanese government's been putting into Medicare are making a real difference on the ground. So fantastic to hear that you're in a position to do that, to be 100% bulk billing. That's exactly the aim of the policy that the Prime Minister announced in the lead up to the budget. When we came to government, Medicare was on its knees. It had suffered a decade of neglect. It had had 6 years of MBS indexation freezes. And because of that, it meant people were paying more to access their health care. Now, the Prime Minister and Minister Butler have started to turn that about in the first 3 years with new models of care like this, Medicare urgent care centres, which are so popular and meeting that need, taking pressure off emergency departments, and is a real contrast between the government that we are and the opposition leader and his future commitments around health. What you see is us trying to strengthen Medicare, build it back, make sure people do only need their Medicare card when they access primary health care, and Peter Dutton, who's going to cut. And we know he has to cut because, and they're making those announcements, maybe saying it out a silent bit out loud, as the PM said. We just saw overnight Sarah Henderson saying that fee-free TAFE is gone. Under them in Tasmania, 6,500 students have enrolled in fee-free TAFE, making a difference, skilling up the next generation of workers. Well, that's going to be cut. That's clear. That was announced yesterday. But we also know he's going to have to cut. He's going to have to cut the public service. Wants to abolish the Department of Health, which actually runs Medicare. We're going to have the Doge-style cuts being taken right through the public service. Senator Nampijinpa Price confirmed that on the weekend. And we know all these cuts are coming. He's actually confirmed these cuts are coming. He's just not going to tell you where they're going to happen till after the election. And he has to do it because he has to pay for his nuclear reactor scheme. $600 billion he has to find through services like this. And the fact that the local candidate here couldn't confirm that this would be bulk billing service under a Peter Dutton government, I think says everything. We know that these are the services at risk, the people in the waiting room who are about to be seen and only use their Medicare card. That is what's at risk through this election campaign.